Hi, Dr. Minkoff, LifeWorks Wellness Center. On this talk, I want to address autoimmune disease. What is it? How does it work? Why do people get it? So as a basic introduction, autoimmune means that you're immune to auto, which means self. So your immune system is actually attacking you. Now the whole purpose and evolution of the immune system is that it's supposed to defend you from foreign things. So if you have friend versus foe, you're supposed to be friend. Foreign viruses, bacteria, parasites are foreign things, and the immune system is supposed to attack them. It's supposed to identify them and attack them. And what happens then where this immune system actually turns on the person themselves, so it's attacking them? And here's the way that I think it goes, and this seems to work out in clinical practice. Just as a sideline, if you speak with regular practitioners who practice rheumatology or immunity type of medicine, the reasons for autoimmunity are very unclear, and almost all of the treatments are directed at blocking the immune system so that it doesn't attack the body. Now, while sometimes this might be helpful in an extreme circumstance, it doesn't ever solve the problem of why did the person get this in the first place. Because usually when this occurs, they're committed to a lifelong trial of steroids, chemotherapy, immune blocking agents, and doesn't really get them back to normal health. So we're taking a different look at it. And our look at it is, why did this happen in the first place? And if we trace this back, what we usually find is that the person has an intestine that is allowing proteins, foreign proteins, to leak into the body. When the intestine is working properly, all of the proteins that one eats, whether it's eggs or fish or meat or soybeans or nuts, those proteins are supposed to be digested down into smaller pieces called amino acids, and those amino acids are supposed to be absorbed, and then our body can rebuild itself using those materials. However, sometimes the lining of the intestine is injured. It can be injured by food allergies, by parasites or funguses or bacterial infections that are in the intestine itself. And when that occurs, it may leak some of these foreign proteins into the body. Now, as probably many of you know, about 60 to 80% of the immune system is actually based around the small intestine. And it's there to protect the body from foreign proteins coming in. So as soon as these foreign proteins start coming in, that immune system reacts. It reacts to the foreign proteins to try to block them, take them out, kill them if they're live organisms, so that they don't get into the rest of the body. Unfortunately, those foreign proteins often look very much like our own proteins. If you have chicken soup with bones and some cartilage and meat, those proteins look a lot like our muscles and our cartilage and our joints. And the immune system may do a calculation, a miscalculation, which is, well, if it's coming in through there, maybe it's found other places. It will see it in other places and it will cause attack. So autoimmune disease could include joint pain, muscle pain. If it attacks brain, it could be trouble thinking, brain fog, can't sleep, depression. Could be thyroiditis. So this whole scope of so-called autoimmune diseases really are based on mostly the same thing. And that is foreign proteins getting into the body and then the body trying to react. Now sometimes also autoimmune disease can be from things like heavy metal toxicity, where people have mercury or arsenic or cadmium that is in the body, and it gets on the surface of cells and makes our own cells look foreign. That's another way that the immune system could look at your own tissue and attack it. But most of it is this. So we have this figured out, and if you've got an autoimmune disease where your doctor has said you've got XYZ, lupus or rheumatoid arthritis or Crohn's disease or multiple sclerosis, the basis of all these diseases is the same. And if you unwind this by correcting the gut, handling heavy metals, this disease you can actually recover, so that your body doesn't have to make these immune particles that attack you any longer, and you can get better. And we have patients where 6 to 9 months later, after they've had the treatment, where their ANA test goes negative or their rheumatoid factor goes negative. And then you say, well, they don't have that disease anymore. And their joint pain and their fatigue and their brain fog have long since gone away. So we know how to handle this. We're really good at it. Most people this really works on. And so if you have a condition like this, or you have a friend or a family member who has a condition like this, come see us, because we can really help.